Welcome to the Deep Dive. We're here today to really embark on a fascinating exploration, looking at a stack of sources that you've shared with us.
That's right.
And this material, well, it brings together some pretty big, complex ideas. We're talking about vaccination, the healthcare system itself, power dynamics within it, and the really crucial concept of making informed decisions when it comes to your own health.
It is quite a mix, isn't it? I mean, we've got official clinical guidelines right alongside some pretty sharp critiques of the healthcare system.
Yeah,
And then there are these analyses of psychological manipulation, even using historical philosophy and also personal reflections, including your own experiences, plus a look at potential new ways to empower patients. It gives us a lot to, unpack.
absolutely. And our mission today in this deep dive is really just to stick strictly to the material you've given us and dig into these different perspectives. You asked us specifically to help navigate these sources
Yeah.
to understand things like, okay, what are the standard recommendations? What role might information or even fear play? Are there potential concerns raised?
Right.
And this idea of Niccolo Machiavelli's philosophy, how that's applied here to healthcare dynamics in one source. And of course, your personal interest, which seems central, in informed decision-making prompted by the experiences you documented for us.
Exactly.
So let's take this stack you've provided and just see what insights we can uncover together, staying right inside the world these sources create.
Okay. Sounds good. Where should we start?
Well, let's start with the official information you included first. We have that source titled Comprehensive Guide to Vaccinations by Age. What's the main focus of that document?
It's essentially a list. A list of recommended vaccines broken down by different age groups, so from babies right through to, older adults.
And it covers quite a range. I mean, you see specific vaccines mentioned like Hib, hepatitis B, polio, PCV, rotavirus,
Chickenpox, MMR, that's measles, mumps, rubella.
right? TDTDAP for tetanus, diphtheria, pertussis, HPV, meningococcal, COVID-19, shingles, RSV. It's a long list.
Yeah, and the source is pretty clear that these vaccines are intended to protect against diseases it describes as potentially serious or deadly. That's the framing.
And that guide gets quite granular, doesn't it? It really
Yeah.
specifies details, like the number of doses needed for some vaccines. It mentions, for instance, the Hive vaccine recommending 3 or 4 doses depending on the brand.
Uh-huh. And the age recommendations are quite specific, too. Like you said, HPV routinely recommended at age 11 or 12, or the shingles vaccine for adults 50 years and older. Very precise guidelines laid out there.
But what I found interesting, even within that particular source, is that it does seem to introduce a bit of nuance sometimes.
How so?
Well, it notes that while many recommendations are routine for everyone, others might actually involve a discussion with your healthcare provider to, weigh the risks and benefits.
Okay. So it's not always just a straightforward yes.
Exactly. It uses the MenB vaccine as an example, stating the CDC does not routinely recommend MenB vaccine for all adolescents, and it suggests having that discussion.
Right. So that shows that even within what seems like standard guidelines, this source acknowledges there can be tailoring based on individual circumstances, or at least a need for discussion.
Okay, so that source gives us a clear baseline of the standard recommendations as presented there. Now, some of your other sources, they seem to pivot quite dramatically. They shift focus to critically examine the healthcare system itself.
Yeah, the bigger picture.
Right, and the dynamics of information, fear, and power within that system. You included pieces like Reclaiming the Soul of Healing and My Journey to Revolutionize Patient Care Began in Childhood. What kind of picture do these sources paint of the current system?
Well, these sources are definitely critical. They present a perspective where the system has changed significantly, maybe lost its way a bit, according to them. They describe healthcare as becoming heavily profit-driven.
Profit.
Yeah, and sometimes inaccessible. And they suggest that really important decisions are increasingly being driven by, well, budgets, politics, and power not patient needs. One source is actually quite blunt about it. It says the system is not always designed to heal, but to sustain itself.
Wow, that's a really stark contrast to the whole idea of patient-centered care, isn't it?
It is.
And several of your sources then seem to explore how psychological dynamics, particularly fear, might be used or just become prevalent within this kind of system.
Right, the role of fear.
You see this in those TEDx talks you included. They explore how fear can manifest, leading to panic attacks or what one source calls catastrophic thinking.
That idea of the mind-blowing small worries up into disaster movies, yeah.
Exactly. And these sources suggest that just understanding how our brains react to fear can be a first step towards maybe overcoming it. We even included that powerful quote attributed to FDR.
Oh, yeah. The only thing we have to fear is fear itself. Nameless, unreasoning, unjustified terror which paralyzes our needed efforts. Powerful words.
And it's fascinating how one of your other sources, this PDF called The Machiavellian Doctor Fear as a Tool for Control, explicitly connects that idea of fear to power structures within healthcare.
Right. This one takes Machiavellian principles, traditionally about how rulers gain and keep power, often through pretty pragmatic, sometimes ruthless means, and applies them directly to the doctor-patient relationship. It's quite a take.
Okay, so how does this source suggest fear functions in that specific context between doctor and patient?
Well, it argues that fear, whether it's fear of illness, fear of a bad diagnosis, surgery, or maybe even just the fear of, not following medical advice, that fear can potentially be used by doctors
Use how?
to maintain authority and control over their patients' decisions. That's the core argument presented. The source suggests that by perhaps amplifying feels to achieve desired outcomes, healthcare providers can reinforce their sort of authoritative stance.
That is a really provocative idea presented in that source.
Hmm.
I mean, it raises significant ethical questions, right?
Yeah.
It suggests that even if the stated goal is the patient's well-being,
Mm-hmm.
using fear as a tool for control could, as this source puts it, lead to a profound dependency on medical authority, creating a real power imbalance.
Definitely. And it stands in sharp contrast to the perspective in another source you provided, fearless health, which really advocates for a completely different kind of relationship.
How does that one frame it?
It argues for a patient-provider relationship built on trust and loyalty through understanding and compassion, explicitly not what it calls domination through fear. So, two very different models presented across your sources.
And just to add another layer to this picture of a complex, sometimes challenging healthcare landscape, other sources you included touch upon difficulties within the system, too.
Yeah, like the practical challenges.
Right. That source on superbug infections, for instance,
Yeah.
it includes observations about doctors potentially lacking knowledge or experience managing critically ill patients at home.
Yeah, I remember that point. It also talks about just how hard it can be to diagnose these complex, emerging resistant infections and issues with test accuracy.
Accuracy.
Yeah, it mentions that a false positive result erroneously labels a person infected, which has consequences, but then it says false negative results are more consequential. So diagnostic challenges.
Okay.
And that same source even includes criticism of what it calls knee-jerk reactions like lockdowns and quarantines, suggesting they could potentially make situations worse or even help infections spread faster in some cases.
So all these details from your sources, they really paint a picture of a system facing some significant hurdles and complexities beyond just the power dynamics.
Absolutely. It's not presented as simple or straightforward in these critiques.
Okay. So we've journeyed from the standard guidelines through critiques of the system itself, exploring how fear and power dynamics are discussed in your sources as potentially shaping interactions. Now let's bring in the personal dimension. This is clearly very important in the material you've provided. You included reflections on your own health history and experiences.
Yes, your sources recount your personal history quite specifically, noting that despite having received only a few vaccinations early in life, you mentioned TB, DPT, and polio specifically.
Right.
You worked for years in what are described as high-risk environments, isolation hospitals, intensive care, critical care units. And you state that during that time, you encountered numerous infections, but you never contracted any of them yourself, including hepatitis B.
Right.
Your account then continues, describing a situation where you felt, and the word used is forced, to take the COVID-19 vaccination for travel purposes.
Right, for travel to India, it mentions.
Yes, and subsequently, you developed MI myocardial infarction, a heart attack, and you state you are now on regular treatment for that.
And your observation, which you detail in the source material you shared with us, is quite specific and quite thought-provoking. You state, no doctor or scientist have understood how antibodies response produced when vaccinated may be causing numerous illness, behavior changes, and also complications that has not been identified or published.
That's a very direct statement from your perspective in the source.
It is. And that personal account, as you've shared it through these sources, it really seems to bring home your core point, doesn't it? About the critical need for individuals to feel empowered to make informed decisions before you take or vaccinate your children. It highlights that desire for agency, for understanding in these crucial healthcare decisions.
And this leads us quite naturally to how some of the other sources you've included propose patient empowerment as perhaps a way forward, a potential way to counter that dependency we talked about or address some of these systemic issues raised.
Okay, how so?
Well, the sources discuss the work of Dr. Kadiali Srivatsa and his project, Dr. Maya GPT. We see this mentioned in sources like Chartika and Dr. Kadiali Srivatsa, Dr. Maya Giving Voice, and also Fearless Health.
Right, Dr. Maya GPT. What is that presented as, according to these sources?
It's presented as an AI-powered health assistant, but it's designed with a very clear purpose to empower people. The material mentions various groups. It aims to help mothers, workers, children, elders, vulnerable adults.
Empower them how?
The goal, as it's described, is to provide them with tools to understand their symptoms and take informed action, really enabling them to make informed decisions about their own health journey.
So presented as an alternative to being, what, passive patients?
Exactly, or feeling totally dependent on external systems or maybe advice that, as some of the other sources suggest, might prioritize system needs over the individual patient's needs.
And the sources also highlight some specific features that are intended to kind of build trust and facilitate this empowerment, right?
Yes, Dr. Maya GPT is described as offering a safe, non-judgmental companion and a confidential, compassionate space for people, including children and vulnerable adults, are mentioned specifically to discuss their health concerns freely.
It even mentioned something about interpreting emotional tone.
That's right. It says it can interpret emotional tone and patterns, which is presented in the sources as helping patients feel genuinely heard and valued. And the idea is that this helps build trust and loyalty.
Okay, and connecting back to that theme of fear we discussed earlier,
Yeah.
how does this empowerment idea, as presented here, relate to fear?
Well, these sources suggest that empowering patients with knowledge and tools, like, for instance, understanding their symptoms through potentially visual methods, the sources mention color-coded systems for Dr. Maya GPT, that this can actively help to alleviate fear. By encouraging proactive health management, this empowerment, according to these sources, is really intended to enable patients to, engage in discussions with healthcare providers, ask questions, and participate actively in their treatment plans.
So it's presented as a potential way to shift that dynamic we talked about earlier, away from dependency, or maybe perceived control, towards more collaboration and informed participation.
That seems to be the core idea put forward in those particular sources, yes, a shift in the dynamic through empowerment.
This has been a really insightful deep dive, I think, looking at this diverse set of sources you provided us. We started with that standard vaccination guidance from one document.
The baseline.
Right. Then we explored the critical perspectives on the healthcare system's priorities that were found in others. We dug into how fear and power dynamics, viewed through that, Machiavellian lens in one source, are discussed as potentially impacting patient autonomy and trust. And then we brought in your personal experiences and your specific observation, as detailed in the material you shared, and looked at this concept of patient empowerment, particularly through tools like Dr. Maya GPT, as is presented in the sources.
Yeah, and it's clear these sources present quite different, sometimes really contrasting perspectives on health and healthcare, isn't it? They really cover a spectrum.
Okay.
From the established medical recommendations on one end to deep concerns about systemic issues, the psychological effects of fear and control dynamics, and then this potential role of technology in maybe rebalancing power towards the individual for more informed decisions. It's a complex tapestry.
It really is. Thank you so much for sharing these sources with us. It's provided a really fascinating lens, I think, through which to explore these interconnected ideas of information, trust, and empowerment, all within the complex world of health decisions.
And maybe as a final thought, something to consider, drawing from one of your other sources, that one titled Soul's Journey, The Truth About Ourself.pdf. Now, that document touches on broader concepts like awakening and awareness,
Okay.
but it includes this really powerful idea. It suggests that crisis moments are collective trials that can lead to awakening or oblivion.
Awakening or oblivion. Strong words.
Right. And it also suggests that the whole process of empowering people actually aligns with awakening consciousness and making informed decisions. It argues that promoting self-awareness and active participation in health can help us avoid what it calls a trap of forgetting the spirit and resist just passively depending on external systems.
Interesting connection.
So the thought to maybe leave you with is this. How does the landscape of healthcare decisions and debates, including all the experiences and perspectives you've shared across these diverse sources, how does that resonate with this idea of a collective trial? And how might striving for that informed decision-making, which is so emphasized in your material, represent a path towards not just individual, but maybe collective awakening and greater self-awareness, potentially averting that oblivion or dependency? It's certainly a profound connection to ponder, drawn right from within the sources you shared.